especially that Dr. House, right? Like whatever is not diagnosed is lupus. It's a meme, I guess. And we always say that whatever we are not able to find the answer, we put it into the autoimmune condition, if not genetics then. But what exactly is happening? Like if I am absolutely no medical background or anything, if you can explain me that what is autoimmunity, we say that our body is fighting against ourselves, right? Like that's what the first year definition of it.
Right, yes.
But with your experience, what exactly it is?
So in layman terms, if you have to understand, right, our immune system is designed in a way that it knows when to be hyper and then when to settle down.
True.
Okay. So when it sees a threat, it will react to it, right? And once a threat is over, it knows how to then tame down, right? When there are constant triggers in the body and the immune system is constantly reacting to these triggers, okay, there's just as an ek ke baad dusra ke baad teesra, there's just so many being bombarded one after the other. Correct. And these are constantly there in the body, right?
What kind of triggers we are talking?
So these triggers can be, these are basically stressors, and stressors can be emotional, right? Stresses can be physical, and here physical stresses are, for example, allergens, right? You're allergic to certain food, but you're not stopping it. You constantly keep eating it. Maybe immediately your body is not reacting to it, but then at the cellular level, things are going wrong, and you think, okay, I'm all good, right? But then these are stresses to the body.
Correct.
Infections. Chronic infections, they just become a part of your cell. Those pathogens just become a part of your cell. True. So the immune system is reacting to that. It's trying to attack that pathogen, and in this process, it is affecting your cell because over a period of time, the pathogens then become a part of your cell. That's why the tissue damage also happens, right? Because immune system intention is not that to affect its own cell, but then because of chronic condition, these stresses just become a part of the cell.
Correct.
Then there are so much of toxins in the environment, right? So all these stresses are constantly triggering our immune system. Immune system is reacting to this. It's just not settling down.
True. Okay.
So immune system, so in a layman term, the immune system has gone haywire, right? It is not tamed down anymore. So this is what's happening in an individual who's diagnosed with an autoimmune condition.
Okay. And is it more in women?
Yes, a lot of diagnosis happens in women, right? But then if you still compare, there's more in women. But yes, men are not. It's not that men do not
they're
get.
Not blessed.
But still, today the incidence is more in women.
Why do you think so? Like women are more exposed to infections or stress, or what could be the reason? Like you talk to so many patients.
See, I won't say women are more exposed. Okay, let's understand what are the most common root causes, right? Ek, of course, infections hai, and these can be viral, bacterial, parasites, and it will not differentiate whether you're a man or a woman. Okay, so it's there, and if you are affected, you are affected.
Correct.
It will not differentiate between a man and a woman. Uske baad, then there are toxins, right? We are breathing the same air whether I'm a woman or a man.
Correct.
We are breathing the same air. We are exposed to similar toxins in the kind of environment we are living in, right? The water we are drinking has microplastics, other toxins, heavy metals, right? Whatever you're using in your kitchen, all that,
Correct.
right? Then heavy metals also come from your personal care products, right? Either आप बोल सकते हो, woman is, probably she's using a lot more cosmetics than a man. So yes, there's one source. If she's not using, if she's not using organic or natural personal care products, and skin is a huge organ.
True.
So whatever you're applying, everything is just getting absorbed, right? So you can imagine the load if you're not using the right products, especially a woman. So that's one. Then deficiencies, of course, right? All vitamins, minerals, again, अगर हम देखें घर पे खाना जो बनता है, right? Be it a man or a woman, everybody's eating the same food. But then there can be more demand in a woman's body.
Correct.
Let's say during pregnancy, the demand is more. And if that need is not addressed, right? Pregnancy, a woman may survive. But then post-pregnancy, you see a lot of deficiencies, a lot of chronic condition diagnosis comes. And in many of these are autoimmune conditions, right? You'll see a woman is diagnosed with hypothyroidism post-delivery. She's diagnosed with an autoimmune condition post-delivery. Why? Because there has been unmet needs in the body.
Correct.
In terms of deficiencies.
Yes.
And still post delivery also it's unaddressed. So then it's contributing to that.